9 early signs of dementia that few people know, and 13 classic symptoms of dementia. Did you know that memory lapses could be a sign of something more serious than just aging? Have you ever wondered if dementia can be prevented? And how can you recognize the early signs of this debilitating condition? These are crucial questions we will explore today. Dementia affects millions of people worldwide, but many still believe it's an inevitable part of aging. Is that true? In this video, we will uncover what dementia really is, the most common types, and the 9 early signs that may indicate its development. Additionally, we'll discuss the 13 classic symptoms and strategies to prevent cognitive decline. What if you could take steps now to protect your brain health? Stay until the end and discover the latest advances in treatment that bring hope to millions of people. Let's get started. What is dementia really? Dementia is a group of symptoms that affect cognitive functions such as memory, language, reasoning, and behavior. It is caused by damage or loss of nerve cells in the brain, interfering with the ability to perform daily activities. Dementia is not a specific disease, but an umbrella term for significant cognitive decline. Although it is more common in older adults, dementia is not a normal part of aging. It is a condition that needs to be properly diagnosed and treated. The myth we need to break. Dementia is not normal aging. It's important to emphasize that dementia is not part of the natural aging process. While the risk increases with age, most elderly people do not develop dementia. Mild cognitive changes, like occasional forgetfulness, are common in aging. However, dementia involves a significant decline that affects daily functioning. Therefore, one should not assume that memory lapses or confusion in older adults are always normal. If persistent concerns arise, it's essential to seek medical evaluation for an accurate diagnosis. The 4 types of dementia you need to know. There are several types of dementia, with Alzheimer's disease being the most common. It is characterized by memory loss, language difficulties, and progressive behavioral changes. Another type is vascular dementia, caused by brain damage due to circulatory problems like strokes. Lewy body dementia presents cognitive fluctuations, visual hallucinations, and Parkinson's-like symptoms. Frontotemporal dementia primarily affects personality, behavior, and language. Understanding the different types is crucial for directing appropriate treatment. 9 early signs of dementia that may go unnoticed. 1. Struggling with words. It could be more than you think. One of the early signs of dementia is difficulty finding words during a conversation. The person may hesitate, use vague terms, or inappropriate substitutes. This difficulty goes beyond occasional lapses, becoming frequent and interfering with communication. They may swap similar words or struggle to name common objects. This sign can be subtle at first, but tends to worsen over time. Paying attention to this persistent difficulty is important for early diagnosis. 2. Changes in the senses, vision, hearing, and more. Sensory changes, such as in vision, hearing, smell, and taste, can be early signs of dementia. The person may have trouble recognizing familiar faces or judging distances and depth. Hearing issues, like difficulty following conversations in noisy environments, can also occur. Changes in smell and taste, leading to a loss of interest in previously enjoyed foods, are other possible signs. These sensory changes can affect the quality of life and indicate underlying cognitive decline. 3. Lack of motivation to do what you always loved. Watch out. Loss of initiative is another early sign of dementia. The person may become less motivated to engage in activities they once enjoyed or to start new tasks. They may appear apathetic, lacking energy or enthusiasm. Long-standing hobbies and interests may be neglected. This loss of initiative may also manifest in a lack of desire for social interaction or family events. This behavior change can be gradual and confused with depression. 4. Muscle weakness could be connected to the brain. Muscle strength issues may be an early sign of dementia, especially in vascular dementia and Lewy body dementia. The person may show muscle weakness, fatigue, or difficulty performing precise movements. Simple tasks like buttoning a shirt or using utensils may become challenging. Frequent falls or trouble maintaining balance can also occur. These motor problems may precede or accompany cognitive decline, signaling the need for medical investigation. 5. Lost in familiar places. Spatial disorientation is a common sign in the early stages of dementia. The person may get lost in familiar places like their own neighborhood or struggle with simple directions. They may become confused when trying to find a specific room at home or navigate known environments. The sense of direction and ability to create mental maps becomes compromised. This disorientation can cause anxiety and frustration, affecting the person's independence. 6. Sleep problems that may reveal much more. Sleep disturbances can be an early sign of dementia. The person may experience changes in their sleep pattern, such as difficulty falling asleep, frequent nighttime awakenings, or excessive daytime sleepiness. The reversal of the sleep-wake cycle, known as sundowning, can also occur, with agitation and confusion becoming more pronounced in the evening. These sleep disturbances can affect quality of life and burden caregivers. Proper management of sleep issues is an important aspect of dementia care. 7. Hunched. Posture and difficulty walking. Postural changes may be an early sign of dementia, especially in Lewy body dementia and vascular dementia. The person may show a hunched posture, muscle stiffness, or difficulty initiating movement. Their walking may become slow, shuffling, or with small steps. These postural changes increase the risk of falls and can affect mobility. They may be subtle at first but tend to progress over time. A physical therapist's evaluation can help identify and manage these changes. 8. Simple tasks becoming complex. Difficulty performing routine tasks is a common early sign of dementia. Familiar activities, such as cooking a simple meal, paying bills, or using household appliances, may become challenging. The person may get confused about the sequence of steps or forget how to perform previously automatic tasks. This difficulty can lead to mistakes, frustration, and loss of independence. Paying attention to changes in the ability to complete daily activities is crucial for early diagnosis and appropriate support. 9. No interest in even talking. Apathy, also known as anhedonia, is a frequent early sign of dementia. The person may lose interest in pleasurable activities, hobbies, or social interactions they once enjoyed. They may appear emotionally distant, lacking motivation or enthusiasm. Apathy can be confused with depression, but in dementia, there is usually no associated deep sadness. This lack of engagement can affect quality of life and relationships. Recognizing and addressing apathy is an important part of dementia care. The 13 classic symptoms of dementia you need to recognize. 1. Total disorientation in time and space. Disorientation is a classic symptom of dementia. The person may get lost in familiar places, confuse the day, time, or season. They may struggle to find their way home or to known locations. Disorientation can happen in relation to both time and space. This can cause anxiety, confusion, and increase the risk of ending up in dangerous situations. Strategies like labels, calendars, and routines can help minimize disorientation. 2. Difficulty planning or solving problems. Difficulty in planning or solving problems is a common symptom of dementia. The person may struggle to follow a plan, work with numbers, or handle financial matters. Complex tasks, such as organizing a trip or an event, may become extremely challenging. The ability to reason and find solutions becomes compromised. This can lead to mistakes, frustration, and loss of independence. Support and task simplification may be necessary. 3. Placing objects in inappropriate places. Placing objects in inappropriate places is a frequent symptom of dementia. The person may store items in strange places and later forget where they put them. Keys in the refrigerator, clothes in the trash, or food in drawers are common examples. This behavior can cause confusion, frustration, and accusations of theft. It's important to be patient, create organizational strategies, and avoid confrontations. Identifying specific places for essential items can help. 4. Mood or behavior changes. Mood or behavior changes are common symptoms of dementia. The person may show rapid emotional swings, going from calm to irritation or sadness without apparent reason. Inappropriate behaviors, such as sexual disinhibition or aggressiveness, can occur. Apathy and social withdrawal are also frequent. These changes can be challenging for caregivers and affect relationships. Understanding that these are symptoms of dementia rather than intentional actions is crucial. Communication and behavioral management strategies can be helpful. 5. Urinary or fecal incontinence. Urinary or fecal incontinence can be a symptom of more advanced dementia. The person may have difficulty recognizing the need to go to the bathroom or finding it in time. Control of sphincters may be compromised. This can cause embarrassment, hygiene problems, and caregiver burden. Approaches like regular reminders, easy-to-access clothing, and incontinence products can help manage this delicate issue. 6. Hallucinations. Hallucinations are possible symptoms of dementia, especially in Lewy body dementia. The person may see, hear, or feel things that are not present. Visual hallucinations, such as seeing people, animals, or non-existent objects, are the most common. They can be vivid and frightening. Auditory hallucinations, like hearing voices, may also occur. It's important to validate the person's feelings without confronting the reality of the hallucinations. Redirection strategies and medications may be necessary. 7. Short-term memory problems. Short-term memory problems are hallmark symptoms of dementia. The person may forget recent information, such as conversations, events, or appointments. They may repeat questions or stories multiple times, not remembering they already discussed the topic. Long-term memory of older events may remain intact at first. These memory lapses can cause confusion, frustration, and dependency on others. Using written reminders, photos, and life stories can help. 8. Social isolation. Social isolation is a common symptom of dementia. The person may lose interest in social interactions, avoiding leaving the house or participating in activities they once enjoyed. They may feel uncomfortable in social situations due to cognitive and communication difficulties. The stigma and lack of understanding about dementia can also contribute to isolation. This withdrawal can affect quality of life and accelerate cognitive decline. Encouraging participation in adapted activities and support groups can be beneficial. 9. Inappropriate behavior. Inappropriate behavior is a possible symptom of dementia. The person may show disinhibition, saying or doing inappropriate things in public. Inappropriate sexual behaviors like making advances or exhibitionism may occur. Verbal or physical aggressiveness, especially during personal care, is also common. These behaviors can be embarrassing and challenging for caregivers. It's important to remember these are symptoms of the disease, not intentional actions. Redirection strategies, calm communication, and environmental adjustments can help. 10. Repeating questions. Repeating questions is a frequent symptom of dementia. The person may ask the same question multiple times in a short period, even after receiving an answer. This occurs due to short-term memory problems and difficulty retaining new information. The repetition can be tiring and frustrating for caregivers. It's important to respond with patience and calm, using simple and direct phrases. Written or visual reminders may also be helpful. 11. Difficulty following conversations. Difficulty following conversations is a common symptom of dementia. The person may struggle to keep up with discussions, especially in groups or noisy environments. They may lose track of the conversation, have trouble finding words, or express thoughts clearly. This can lead to misunderstandings, frustration, and social withdrawal. It's important to speak clearly and slowly, use short sentences, and give the person time to process information. Minimizing distractions and background noise can also help. 12. Loss of time awareness. Loss of time awareness is a characteristic symptom of dementia. The person may confuse the day, month, or current year. They may struggle to remember important dates, like birthdays or appointments. The passage of time may seem distorted, with the person believing recent events happened a long time ago, or vice versa. This temporal disorientation can disrupt daily routines and cause confusion. Using calendars, clocks, and structured routines can help maintain a sense of time. 13. Difficulty making decisions. Difficulty making decisions is a common symptom of dementia. The person may struggle to evaluate options, weigh pros and cons, or come to a conclusion. Simple choices like what to wear or what to eat can become challenging. More complex decisions like financial or health matters may become even more compromised. This difficulty can lead to indecision, anxiety, and reliance on others. Offering limited, clear options and giving time for decision-making can be helpful. Causes of dementia. Several conditions can cause dementia, with Alzheimer's disease being the most common. In Alzheimer's, abnormal protein accumulation occurs in the brain, leading to nerve cell death. Vascular dementia is caused by brain damage due to circulatory problems like strokes. Other causes include Lewy body dementia, characterized by the accumulation of the protein alpha-synuclein, and frontotemporal dementia, which affects the brain's frontal and temporal lobes. Risk factors include advanced age, family history, cardiovascular diseases, and an unhealthy lifestyle. Preventing dementia. 1. Control diabetes. Proper diabetes management is an important measure in preventing dementia. High blood sugar levels can damage blood vessels and affect brain function. Keeping blood sugar within recommended levels through a balanced diet, regular exercise, and medication when necessary can reduce the risk of dementia. Moreover, controlling diabetes also benefits cardiovascular health, another risk factor for cognitive decline. 2. Quit smoking. Quitting smoking is a significant preventive measure against dementia. Smoking is associated with an increased risk of cognitive decline and dementia, especially vascular dementia. Smoking damages blood vessels, reducing blood and oxygen flow to the brain. Quitting smoking, even at older ages, can bring benefits to brain health. Resources such as nicotine replacement therapy and behavioral support can aid in the quitting process. 3. Manage stress. Managing stress is an important strategy in preventing dementia. Chronic stress can negatively impact brain health, affecting memory and cognitive function. Practices such as meditation, deep breathing, and relaxing activities can help reduce stress levels. Additionally, maintaining positive social relationships, enjoying hobbies, and balancing personal and professional responsibilities also contribute to mental well-being. Taking care of emotional health is as important as taking care of physical health in preventing cognitive decline. 4. Challenge your brain regularly. Regularly challenging your brain is a way to promote cognitive health and prevent dementia. Mentally stimulating activities such as puzzles, word games, learning a new language or musical instrument can strengthen brain connections. Reading, writing, and intellectual discussions are also beneficial. These activities stimulate brain plasticity, helping keep the brain active and resilient. It's important to choose enjoyable activities and vary the stimuli for the best results. 5. Physical activity. Regular physical activity is essential in preventing dementia. Exercise improves blood circulation, providing more oxygen and nutrients to the brain. In addition, physical activity stimulates the production of growth factors that promote neuronal health. At least 150 minutes of moderate aerobic activity per week, such as brisk walking, swimming, or dancing, is recommended. Strength training and balance exercises are also beneficial. Finding enjoyable activities suited to individual physical conditions is crucial for long-term adherence. 6. Stay socially active. Staying socially active is an important strategy in preventing dementia. Social engagement stimulates the brain, promotes emotional well-being, and reduces the risk of isolation, a risk factor for cognitive decline. Participating in group activities, such as book clubs, art classes, or volunteering, can be beneficial. Cultivating meaningful relationships with family and friends is also essential. Social interaction provides opportunities for communication, emotional support, and cognitive stimulation, contributing to long-term brain health. 7. Improve your sleep. Improving sleep quality is an important preventive measure against dementia. Adequate sleep is essential for memory consolidation, the elimination of brain toxins, and maintaining cognitive function. Establishing a regular sleep routine with consistent sleep and wake times can help. Creating a comfortable sleep environment, avoiding screen use before bed, and practicing relaxation techniques are also beneficial. Treating sleep disorders such as sleep apnea is crucial for ensuring restorative rest. 8. Lose weight. Losing weight, if necessary, is a preventive strategy against dementia. Obesity is associated with an increased risk of cognitive decline and dementia, especially when it occurs in middle age. Excess weight can affect vascular health, increase inflammation, and impair brain function. Adopting a balanced diet, rich in fruits, vegetables, whole grains, and healthy fats, along with regular exercise, can help achieve and maintain a healthy weight. Small, sustainable lifestyle changes are more effective in the long term. 9. Cognitive reserve. Developing cognitive reserve is a preventive approach to dementia. Cognitive reserve refers to the brain's ability to cope with damage or pathology while maintaining cognitive function. Factors such as education, complex occupations, and involvement in mentally stimulating activities throughout life contribute to building this reserve. The greater the cognitive reserve, the more resilient the brain is to challenges. Therefore, continuous learning, engaging in challenging hobbies, and maintaining an intellectually active life are valuable strategies. 10. Improve your diet. Improving your diet is an essential preventive measure against dementia. A healthy diet provides the nutrients necessary for optimal brain function. The Mediterranean diet, rich in fruits, vegetables, whole grains, fish, olive oil, and nuts, is associated with a lower risk of cognitive decline. Limiting the intake of processed foods, added sugars, and saturated fats is also important. Incorporating foods rich in omega-3s, such as salmon and walnuts, and antioxidants, like berries and leafy green vegetables, can be beneficial for brain health. 11. Control blood pressure and cholesterol. Controlling blood pressure and cholesterol is crucial in preventing dementia. Hypertension and high cholesterol are associated with an increased risk of cognitive decline and vascular dementia. These factors can damage blood vessels and affect the supply of oxygen and nutrients to the brain. Adopting a healthy diet, exercising regularly, and managing stress can help keep blood pressure and cholesterol at appropriate levels. In some cases, medication prescribed by a doctor may be necessary. New developments in dementia treatment. Research into dementia treatment is constantly evolving. While there is no cure yet, new developments aim to improve quality of life and slow the disease's progression. More effective medications to control cognitive and behavioral symptoms are being studied. Non-pharmacological therapies, such as cognitive stimulation, occupational therapy, and adapted social activities, have shown benefits. Advances in early detection through biomarkers and imaging tests may allow for timely interventions. Research is also exploring innovative approaches like immunotherapy and gene therapy in the search for disease-modifying treatments. Conclusion: a better future for your mind. Dementia is a complex condition affecting millions of people worldwide. Recognizing the early signs, classic symptoms, and causes of dementia is crucial for awareness and early diagnosis. While there is no cure yet, adopting preventive measures like managing risk factors, cognitive stimulation, and a healthy lifestyle can reduce the risk of developing the disease. As research progresses, new developments in treatment offer hope for improving the quality of life for those affected by dementia. Taking care of brain health throughout life is a valuable investment for a cognitively healthier future. Don't forget to subscribe to the channel. I wish you great health, wealth, and happiness. See you in the next video.